What's up, Blanco ladies? Welcome back to the channel. Today we are going to talk about a certain surgery that I imagine a lot of you are interested in possibly getting. So we are going to be talking about the tracheal shave. So I am interested in covering voice feminization surgery as well as facial feminization surgery as a whole, but I wanted to cover this because there is a lot to say about it. I personally wanted to do it because I'm getting mine done in September. In a month and a half, this fucker is out of here. No more. I wanted to cover it because it's something I wanted to prepare myself for, and I strongly suggest you stay tuned because on the latter half of this video, I'm gonna go over the exact documents I received of pre-op instructions in order to give you an idea of what you're in for. This is the stuff I'm gonna have to do in order for the surgery to go smoothly. So we're gonna get right down into it, but if you don't know anything about me in particular, my name is DIMITRIA SPARROW. I aid trans women, cross-dressers, or anyone who wants to present themselves feminine in giving you the knowledge necessary on how to be the long, cool lady I know you are inside. A tracheal shave is also known as Adam's apple reduction surgery, a chondrolaryngoplasty, or thyroid cartilage reduction. It is done by shaving the cartilage down from the Adam's apple by making an incision in the throat. So again, this is a process of shaving down rather than removing the Adam's apple. You can't really remove the Adam's apple. The Adam's apple, or larynx, is the prominent part of the thyroid cartilage, that which houses the vocal cords, and contrary to popular belief, both genders have one. It is that during puberty that the larynx physically grows a lot larger in boys rather than girls. This is a period of time when a young boy's voice cracks or squeaks, which does not settle down until the larynx is done growing. What? Oh. It's generally considered a type of facial feminization surgery. It is mostly done by trans women, sometimes non-binary individuals, also from cis men and cis women. Some cis men have way too big of an Adam's apple. Some cis women have a little too prominent of an Adam's apple to where they'd want to slim it down. What do they do to your Adam's apple? What goes on during the surgery? So firstly, you're put under by anesthesia. It's generally a 30 to 60-minute procedure. We'll say 60 minutes. A small horizontal incision is made at the bottom of the Adam's apple. The muscles in the throat are held apart by forceps, and the protruding cartilage is shaved down with a scalpel. And this, therefore, makes the throat appear smoother and less angular, the goal. The incision is then closed by sutures, which I actually didn't know what that meant. It's basically sterile surgical threads, as in stitches. They close it up with stitches. The surgery is typically outpatient, meaning that the patient does not need to stay overnight at the hospital once the procedure is completed. What needs to happen prior to surgery? Typically, a down payment needs to be made to secure the procedure date. They're gonna need some sort of deposit. With a surgery like this, it's resembling more of a down payment on a car. The full payment has to be due prior to the surgery date. For me, it's 2 weeks. You need to book off at least 1 week from work. So the healing process takes longer than that, but they're telling you you need at least a week to do absolutely nothing. After that, you can sort of go back into your more daily activities. You can start getting on your feet again and you can return to work. But make sure you have at least a week off of work. You should stop smoking a month before the surgery and 2 weeks post-surgery. Vaping does not get you off the hook either, so don't try to pull a fast one. You will need a caregiver during the day of the surgery. We're talking about the person that needs to drive you there and take you home. You're gonna be waking up from anesthesia, so you're not gonna be in any position to take yourself home. The thing with any trans sort of specific surgery, it can be a little more challenging and a little more difficult to find a caregiver because your family situation possibly may not be very good. You need a caregiver who is understanding of the surgery you're undertaking. You need to have someone who is an adult who can be available throughout that entire day of the surgery. Very, very important. A prescription for medication will be provided to you. It will be sent to your pharmacy. You should be picking it up prior to the surgery in order to use it after the surgery. There likely is going to be a fee on it, so if you have benefits, some of it is going to be covered. A+. There are a few things that the surgeon is going to require that you do. First thing is you're going to need to do a blood test. And second, you need to do what's called an ECG. It stands for an electrocardiogram test. It typically takes 5 to 10 minutes. And finally, during the state of the world right now, you do have to take a COVID test 6 to 7 days prior. You likely will be assigned an aftercare shopping list. This is just standard off-the-shelf stuff like Tylenol, Gravel, or ice packs. Stop taking blood thinners a week before surgery. Aspirin, Coumadin, or Plavix, or any other homeopathic medications should not be taken at least 5 days before surgery. Tylenol and Advil should be just fine. I know us girls like our nails, but any nail enhancements, artificial nails, or any nail polish has to be taken off your hands and your feet. It's to monitor your oxygen. Pretty much, you technically, I suppose, only need one nail taken off. I've asked them about that, and they're pretty adamant that they're more comfortable working on you if all your nail polish, all of that is off. You need full bare natural nails. Another thing you want to work on is removing any jewelry or body piercings. There is a medical procedure known as electrocautery. This involves the passing of a high frequency electric current passing through the area being operated on. So if there's any metal on the body or in the body, there's a risk of the metal in the jewelry conducting an electric current, causing some severe burns. Call them in advance if you can do this, but if you don't want to close up your piercing, what you can do is replace the jewelry that is either like titanium, surgical steel, or niobium or whatever, and replace it with acrylic plastic. Again, just run it by the surgeon just to be sure it's 100% okay, but that should be sufficient. There's no metal. It won't conduct an electric current, so you should be okay with that. You cannot drink or eat after midnight the day of the surgery. This includes water, includes gum or candy. This is standard procedure for surgeries. See what they require from you. This is likely what you're gonna have to follow unless otherwise instructed. If you do not abide by these rules, it could result in the surgery being canceled. After all of that planning, you basically booked off a day of work and now you're screwed because you were stupid. And lastly, what I would advise you to do is plan your route. So think about who you are driving with. I don't drive, so my girlfriend is gonna be taking me to Toronto. Toronto for us is about at least an hour. The date of my surgery is September 15th, but the actual specific time is to be determined. So we need to figure out, okay, if it's an hour, what highway are we taking? Are we taking the highway? What time do we have to get up? And if there is traffic, how much earlier do we need to be getting going in order to be able to get there on time? Are there potential risks from the tracheal shave? Particular care is used by the surgeon to not remove an excessive amount of cartilage. One thing you have to understand is, again, we're not removing the Adam's apple, we're shaving it down. The surgeon is concerned about your health, and they take particular care in not touching the vocal folds that are around the area of the surgery. Don't be super disappointed that it's 100% perfect, because depending on your Adam's apple structure, depending on the size of it, it may not be 100%. If they go too far, it can reduce the structure of the trachea and cause breathing difficulties. Due to the proximity of the vocal folds, there's a small possibility they will be damaged during the surgery. Generally, however, the patient's voice is unaffected. Just make sure that your plastic surgeon is experienced. They've done this numerous times. They know what they're doing. So this leads into one of the possible sort of risks / questions that I had and others may have. Does it affect your voice? Because I was concerned about this too, and I made sure to address my issues because I spent over 2 years trying to go from this voice to this voice, so I didn't want to have to deal with any sort of damaging to my vocal cords. So it can adversely affect your voice if it is done by an inexperienced surgeon. The goal is to change the physical size of the Adam's apple while not affecting the voice whatsoever. What's good is if the plastic surgeon tells you in advance without you even having to ask, I will see what I can do with your Adam's apple, with your neck, your structure, and all the stuff in between. They're basically telling you this is the result I can give you, because too much removal of the cartilage will leave the voice chronically hoarse. It's a very difficult thing to correct afterwards, so not screwing it up is very deeply important. Is this a way to feminize my voice? Not really. Shaving the cartilage down too aggressively will more just sort of damage your vocals rather than alter them in a more feminine way. So does it leave scarring? It sort of depends on various factors. It could be depending on the surgeon's skill level. It could be just your biological tendency to form scar tissue. It depends on your job and your diligence in the healing process, how well you abide by post-op instructions. It's advised to attend those post-op appointments suggested. There could be cosmetic treatments like laser or micropigmentation techniques that will reduce the scar tissue and the redness involved. You likely will be provided with a sort of topical ointment. It's usually silicone-based from what I've heard, and you massage it to break up some of the scar tissue within that area. So we're going to be talking about the cost. We're going to be talking reality. I'm not going to disclose how much my clinic charges for a tracheal shave, but I will give you a general ballpark as to what you're going to expect with a tracheal shave. The general out-of-pocket rate is $3,000 to $5,000 US. And if you live in Canada like me, that's generally around 3,800 to 6,300 Canadian dollars. Don't forget tax as well. Very rarely will health insurance companies cover it, as it is a cosmetic procedure. I tried with mine. Doesn't work. They may ask for a 20% deposit or down payment to secure the procedure date. The deposit may be fully refundable 2 weeks prior to the surgery date, and full payment of the procedure is required 2 weeks prior to the surgery. On top of how much it's expected to be, some parts of the total is taxed. So on my invoice, it is comprised of 3 fees. So there's the procedure that is done by the plastic surgeon, 1 hour of anesthesia, and there's a hospital facility fee for 2 hours. So the anesthetic fee was not taxed, but the other 2 were. Look at what the invoice is going to tell you, how much tax you're actually going to have to put up with. And say if it's $5,000, let's ballpark it, you have to also throw in the prescription medication that you're going to have to be picking up, possibly these softer foods that you're going to have to buy. Keep in mind the amount of gas it's going to take you. It's likely not going to be in your hometown. You're lucky if that's the case. But I have to go to Toronto. That's like an hour of gas there and back. Plus the post-op appointments, 3 or 4 more trips of 2 hours every time. So you have to throw in the gas money as well. In terms of adding up all your expenses, in terms of what all of this is going to cost you, think about if the post-op appointments are going to be included in the initial cost. And lastly, I would see if they recommend a health insurance company to where you can be able to afford this surgery, because this is not something that you can typically take out of pocket. See what they recommend and see what's in your area to where you're going to be able to pay it off in a reasonable amount of time that you can manage. After surgery, you're going to be taken into a recovery room. You're going to be monitored for a brief period of time to see that you're doing okay, and then they're going to discharge you. However, on the flip side, some patients actually pair up a tracheal shave with other facial feminization surgeries, sort of all in one day. So in that case, you're going to be required to stay in the hospital overnight. The caregiver is usually called 45 minutes to an hour before the surgery is done, just so they have, they're not not in a rush to come get you. They know when it's gonna be finished and they're gonna be able to come get you. The hospital will not allow you to take a taxi or take a public bus by yourself. You will need a caregiver. The recovery process. Pain is usually very minimal. It's easily managed with medications you're encouraged to take, as well as being conscientious in the aftercare instructions. Again, you're taking a week off, but it's advised to do absolutely nothing, Patrick Star style, for 1 to 2 days. Avoid any vigorous activity. Avoid speaking loudly or singing. Soft foods and a more liquid sort of diet will be very soothing and helpful to you until you're comfortable sort of swallowing and eating more solids. Apply ice as instructed. Keep your head elevated while sleeping to minimize post-operative swellness and soreness. You're dealing with a sore throat for a few days. There's gonna be swelling, bruising, and some redness at the surgical site. There's gonna be slight pain. It shouldn't be overbearing pain, like you're getting the surgery done again while you're not put under. It's not supposed to be that painful. Your voice is going to be a little hoarse, a little more on the weak side. So I mean, in the first 1 to 2 weeks, that is gonna be normal, so don't be alarmed. It's surgery around your throat. You're expecting something to happen. And as you'd expect, you're likely dealing with some trouble swallowing the first few days. These are normal the first week. So if you see anything or feel anything that is out of the ordinary, never hesitate to call the clinic, call your doctor. More alarming symptoms you should be calling your doctor for are fever, severe pain at the incision site, chest pain, shortness of breath, or an erratic heartbeat. Healing time, like I said, is 2 to 4 weeks. After 1 week off, you should be able to get back on your feet. After surgery, you will have stitches at the incision site, which will be removed 7 to 10 days after the initial surgery. Another thing that you'd think would be common sense. How do I put this lightly? When you deal with gender dysphoria, some things that would initially be common sense are more clouded with, but this makes me feel like a man, so I need to do it. Don't shave. No matter how much is gonna be there, don't shave anywhere near the area, especially when the stitches are still in. If you're undergoing laser hair removal, hold that off. The facial hair can wait. You may be instructed to apply a topical steroid cream or some sort of ointment to massage around the incision. This is basically to prevent the formation of scar tissue. You need to stop smoking. Like I said, that will affect the healing process, and there will be a series of post-op appointments at the clinic. And in these post-op appointments, for me, it's PDL treatments. This is all to reduce scarring and to accelerate the healing process. In those post-op appointments, they're going to be able to monitor how the area is doing in terms of healing. So the surgeon is going to be right there with you in the healing process to make sure everything is going smoothly appointments down the road. Lastly, before we get into the GC document, what should I ask my doctor beforehand? Ask them how often they do this particular surgery. How often do you tend to do a tracheal shave? How often do you do this procedure on someone who is my age, someone of my weight, and someone of my ethnicity? Ask them if there are post-op appointments, how many there are, and if they're included in the initial cost. Who will my anesthesiologist be? And can I meet them prior to the surgery? I've told you some of the risks involving a tracheal shave. It's better to listen to the experts. Ask them what the potential risks are. And if you're interested, if you have the money, ask them what other facial feminization procedures you would possibly recommend for me. All right, you may have just skipped to this point. I'm gonna go over the document that specifically pertains to me, to this clinic. Do not bring any valuables with you to the hospital the day of the surgery. Please make sure to remove jewelry, body piercings, and nail polish off your fingers and toes. You will need a friend or family member available the entire day to be your caregiver. They will need to pick you up and drive you home after, and nice little note here. There is a lovely walking trail across the street. There's a Tim Hortons, because we're Canadian. There's this restaurant. There's a McDonald's up the street. The nurses will call the patient's caregiver at around 45 minutes to 1 hour before the patient is ready to be discharged. Patients may receive a call from this doctor at the clinic in Toronto to have a pre-op phone consultation before surgery once they have reviewed the completed patient health questionnaire. The clinic will also reach out a couple days before to go over COVID screenings. Booking agreements. So this is a sheet I have to check off and send over. Should I need to reschedule or cancel the surgery, I must provide 2 weeks notice. Failure to do so will result in my deposit being forfeited and another deposit will be required to rebook. A prescription for medication for after surgery will be sent to your local pharmacy. Should you require a surgical revision, my doctor will cover the surgeon's fee. However, it will be up to the patient to cover the facility fee and the anesthetist fee. So I have to basically sign that. Patient health questionnaire. This is to see, a general health summary of how healthy you are, what conditions you have. I'm generally pretty healthy. I'm only 22. Patient identification level. Do you have or have ever had any of these things? So these are general sicknesses, thyroid problems, liver disease, diabetes. I don't believe I have any of those. Preparing for surgery, general aesthetic. This is all stuff that I'm supposed to be getting for after the surgery to aid in my healing process. So I am instructed to get hydrogen peroxide, Q-tips, polysporin, some sort of polysporin ointment. So it needs to be an ointment, not a cream, Vaseline or Aquaphor, ice packs, an extra strength Tylenol or Advil, Gravel, pick up medicine from your pharmacy prescribed by the doctor, 3 weeks before surgery. So basically I need to get the blood work done, the ECG test, and my COVID test, and complete that health questionnaire and submit it to their bookkeeper, I believe. 1 week before surgery, I need to stop if I take any blood thinners a week prior to the surgery. Do not resume blood thinners or take aspirin for 7 days after the surgery. I don't take any of that. Your prescription should be ready to pick up a week before surgery. Another interesting thing they bring up is actually stop all vitamin supplements. It's in bold, so I'm kind of scared. I don't know if this is something I specifically am being told to do. I don't know if this is a general thing. It's saying stop taking all vitamin supplements, especially fish oil and garlic supplements, due to a bleeding risk. Days before surgery, so mandatory hygiene is close to your surgery date to remove nail polish and nail enhancements. To monitor your oxygen, at least 1 nail must be natural. Remove all jewelry and body piercings. At home, make sure your ice packs are in the freezer. Have some light meals like soup for after your surgery. Sometimes people experience nausea after a general aesthetic. These are going to be the post-op appointments for me, at least. Here's what is going to happen for me. So I have my surgery. I have the tracheal shave. Then the first post-op appointment is 1 week after, where they're going to remove the stitches. I'm provided with a scar gel. It's silicone based, which promotes healing. It reduces a lot of the scarring. So I'm to use it, give or take, a couple times a day. It's given to you when the general incision is closed. The next surgery, again, these are more to be determined. It's usually a month after the surgery. It is a follow-up appointment of a PDL treatment. So PDL is what's called a pulse dye laser. So it's a concentrated beam of light that targets blood vessels within the skin. The light is converted into heat, destroying the blood vessel while leaving the skin undamaged. Basically, it's done to improve the appearance of redness within scarring, and it's also done on skin conditions like rosacea. Personally, what they're telling me is they're using a what's called V-beam. These are pretty quick post-op appointments. They're usually a few minutes. No anesthesia is required. The treatment is going to be done on the incision site to rid of redness and bruising to help with the healing process and reduce the overall scarring. How many of these appointments? It's usually what I've been told 2+, depending on how you're doing with the healing process. Generally 2 or more. So that is generally the document. I didn't want to just read it. I wanted to make it not that boring, but this is what I received. Okay, so I definitely will be making a video getting to the clinic and my healing process throughout. I'm gonna be talking a little bit like this, so hopefully it'll be fun and we'll have a nice before and after picture. Hopefully this video gave you some insight into what to expect in getting a tracheal shave. So there you go. I will be doing other videos like this in the future on certain trans MTF leaning sort of surgeries in order to give you all of the knowledge and information necessary if these are surgeries you want to take on. So thanks very much for watching. I hope you enjoyed this, and if you like videos like this, be sure to give me a like and subscribe to let me know that you want to see more content like this. Stay beautiful, everyone. Take care.